Assalamu alaikum.
किसमें? कल आपको मैं घर पे ही रहूंगी।
हेलो, अस्सलाम वालेकुम। हेलो, आवाज आ रही है? First of all, today we start with the tumors of the central nervous system. So, first of all, they are called the intracranial tumors. So the most intracranial tumors, and they are the most probably that the primary and or the metastatic tumors. So the metastatic tumors, and they are the metastatic tumors, and they are the more common. They also coming from the other primary sites, from the breast, from the bone, and from the lungs and the kidney and the skin. So they are the most commonly metastatic primary tumors. So the intracranial tumors, they also comprising primary tumors, and other group is a metastatic tumors. So primary intracranial tumors and intracranial tumors, they will also can be including from the arising from the glial cells. So the central nervous system, and they are also having that they comprising glial cells and some of the macroglial cells, and the glial cell comprising astrocytes, oligodendrocyte, ependymal cell, and also the macroglial cell. They are also functioning as a phagocytic system. So these glial cell, and they also having their originating some type of the tumors from the primary side. So the primary intracranial tumors, and they are the second most common. So they are the second most common group of the tumors, and within they also can occur in the children, and after the leukemias and the lymphomas. So after the leukemia and lymphoma, the most common tumor, they also can occur within the children. They are the primary intracranial tumors. The most common primary intracranial tumors, and they are of glial origin. मैंने आपको बताया कि glial origin, and they are also can be called as the gliomas. They are the major term called the gliomas. The glial cell comprising like the astrocytes, and also the oligodendrocyte, and third one is the ependymal cell, and the coral plexus, and also the macroglial cells, and they are also functioning as a phagocytic system, like the macrophages within the central nervous system. In the gliomas, and they will also can be comprising astrocytoma. It is a most common tumor called the glioma, comprising of about the 65% of the cases. So the gliomas comprising astrocytoma, oligodendroglioma, and also the ependymoma and coraplex tumor. So these tumors, and they will also can be comprising in about the 65% of the cases. So the other like the meningiomas, and they also can comprising of about the 10% of the cases, and also the acoustic schwannoma, They are the neuronal tumors comprising either the neurofibroma and the schwannoma, and comprising of about the 10% of cases, and medulloblastoma comprising of about the 5% of cases. They are termed as the pool differentiated neoplasms, and also the other type of the tumor having the melanophomas, and also the other tumor, they are metastatic and from the other pyramid side, like they from bone, from the skull, and also the vertebra, and also the other side like the skin, kidney, breast, lungs, and comprising of about the 10%, they are termed as the metastatic tumors. So the annual incidence of the tumors of the central nervous system, and they also can central nervous system, they also ranging from the 10 to 17%, 10 to 70% of the 100,000 persons, and for the intracranial tumors, and 1 to 2 per 100,000. These also can be, they're the persons, and they are for the intraspinal tumor. Most probably these tumor, and they will also having the incidence of these tumor of the central nervous system, they are ranging from the about the 10 to 17 per 100,000. 1 लाख में से आपको 10 से 17% वाला 10 to 17 person, they also can be affected. And about the intraspinal tumor, they also comprising of about the 1 to 2%, 1 to 2 per person out of the 100,000 persons. Okay, persons, and for the intraspinal tumors. Okay, and also the about and half of these they also having these tumors, and half to 3/4, and they are also the primary they are the primary tumors, and also the primary tumors, and also having the from the wrist, and they are also the some other the beta cell tumors. Okay, so these the tumors of the central nervous system, and they will also can be accounts for about 20%, account for the 20% of all the cancers of the children. Okay, ठीक है. So about the 70%, of the childhood central nervous system tumor, and they also can be arising and within the posterior canal fossa. Okay, they also arising from the posterior canal fossa, and also comparable, and they also having the comparable number of the tumors, and in the adults. Okay, so they also can be arising and within the cerebral hemisphere. Most probably also can be occur within the cerebral hemisphere, and above the tentorium, Okay, so the tumors of the most probably the most tumors of the central nervous system, and they will also having several unique characteristic features. Okay, unique characteristics, and that also can be said them, and they also can be apart from. Okay, the distinction between the benign tumor, the distinction between the benign and the malignant central nervous lesions, it is also less evident. Okay, less evident, and in the central nervous system, and then also can be occur in other organ system cancers. Okay, some glial tumors, and with they are also having some they are the histological features of the some of the gland tumor. They also having histologic features of the benign neoplasm, and they also can including, and they also having their low metastatic activity rate, and also having their cellular differentiation, okay, cellular uniformity, and also having their and they are also having their low growth rate. Okay, so these are the some features, and they are also having their like the benign lesion. In malignant condition, they are also having some anaplastic feature like the high cellularity and high there is increased polymorphism and also the increased metastatic activity. So in benign tumor, so these tumors of the central system are the benign, having the benign cystic feature like the low metastatic activity rate and low growth, and also having the uh, cellular uniformity. Second thing, they also having the ability, they also can ability to surgically resect. Surgically resect, and they also can be showing the infiltrating, and these are the infiltrating the glial, and most probably there is the glial neoplasms, and they with the neoplasms, and without the without they are also having the okay, so these are the some characteristic features and of these tumors, and they are also having their activity. So this is the broad classification of the central nervous system tumors. They are the four categories. There are four major classes of the intracranial tumors, and they are also divided. Number one, gliomas. Number second one is a neural tumor. Gliomas, and they are comprising of about the astrocytoma, oligodendroglioma, ependymoma, another and its variant, and third, and there is the coral plux tumor. So the neural tumor, and they also comprising there is schwannomas, and also there is the neurofibroma, and also having there the melon derivatives. And the third one is a poorly differentiated lesions, differentiated uh, neoplasm comprising medulloblastomas and meningiomas, and also having there the other different variants. So glioma is also a major term. So glioma is comprising out of the intracranial tumor about 65% of the cases. So gliomas, and they are derived from the glial cell origin, glial cell, and they also can be including most probably the astrocytoma. Astrocytoma, they are showing the different variants, and another one there the oligodendrogliomas, and also having there the ependymomas, and other the coral plux tumor. So this is also broad classification of the central nervous system. This is a cellular derivatives and of the cellular derivatives of the neoplasms and other. There's also the tumor, most probably. This is also a tumor. Most probably, there's a list of the tumor. Number one. So these are the LUND. Number one, there's a tumor arising from the glial cell. They are also called the gliomas. Tumor arising glial cell comprising astrocyte, and there is the oligodendrocyte, and third one is the ependymal cell. So these are the cells. They are also going to group into the glial cell. So the astrocyte, the cells, they are known as astrocyte. They also can be astrocytoma. They also can be arising from the astrocytes. They are the glial cell. Another one, there is the oligodendrocyte. They are also having there the oligodendrogliomas, and also with the well differentiated, and also there some there is well differentiated anaplastic oligodendroglioma. Okay, take astrocytoma, and they are also having the other different variant like the fibrillary, diffuse fibrillary astrocytoma, and also the pilocytic astrocytoma, and third one is there is the glioblastoma multiforme, and fourth one is there is xantho astrocytoma. So these are the some variants of the astrocytomas. So oligodendroglioma, they are showing there is well differentiated, and the undifferentiated or the anaplastic. Ependymal cell, the tumor arising from ependymal cell called the ependymoma, and also the subependymoma. So these are the some lesions, and they are also having there the ependymal cells. Okay, So these are the tumor arising from the glial cell and comprising astrocyte, and there have the oligodendrocyte, and third one ependymal cell. So the other cell of origin, there is a tumor arising from the neurons. So they also can call there the some they are called the neural cell, and also having called the medulloblastomas. So other tumor arising from the mixed glial cell, mixed glial, and there the neural cell. They also can call the ganglioglioma, gangliogliomas. Okay, so the tumor arising from the there the pinocytes, and their pinocytes. They are also called the tumor arising from pinocytes. There are the pinocytomas, and another one there is the pinocytoblastomas. Okay, so tumor arising from the cells, they are derived from the, they also can be derived from the neural cell. They are called as the neurofibroma, and also the schwannoma. They are called the Schwann cell. Schwann cell, they are the malignant cell, and they also tumor arising from the Schwann cell or the neural cell called the schwannoma, and it's a malignant variant, and also the neurofibroma. Okay, the tumor arising from the arachnoids, and they are also called as the, most probably there is a meningiomas, meningeal lining the arachnoid space. So the tumor arising from the other cell of origin from the canal tissues, they are called as sarcoma. Different type of the sarcomas, different type of the sarcomas. ठीक है, तो फिर, so the other cell of origin, there is the lymphoid cell. Lymphoid cell, the tumor arising from lymphoid cell, they are called as the malignant lymphomas. So the tumor arising from the, there is the there is the vascular cell, they are called as the hemangioblastomas, and there is the uh, pituitary tumor arising from the pituitary cell called the, there is the pituitary adenomas, and also tumor arising from the, there is embryonic, and there are also having the embryonic uh, remnants, and they are also called the cranopharyngiomas, cardomas. So these are the tumor arising from the an epidermoid cyst, and there is the dermoid cyst. These are tumor arising from the embryonic cells. Okay, the tumor arising from the notochordal tumor is also called as the cardomas, and other tumors arising and from the germ cell, teratomas, and also the other tumors like the laminomas, and these are some tumor arising from the germ cell teratoma, mature teratomas. Okay, so there's the melanocyte, tumor is from melanocyte, they're called the melanoma. So the tumor also having there is some, there is the cell of origin arising from adipocyte, there is the lipomas, the lipomatous lesion, and then there is the tumor arising from the there is the metastatic tumor made from the primary side. Metastatic tumor, they are also having there is a tumor of the different side from bone, and also having the different from skull or the vertebra and the spine. So these are the some tumor from the metastatic, and some other metastatic tumor arising from the primary side, and like the from the lung and the brain, breast, like the lung, breast, and the kidney and the skin and GIT. This is the exercise system. So these are the some tumor arising from the frequency, from the order of the frequency. So this is also a list of the major huge classification the central nervous system tumor, comprising there the gliomas and neural tumor, and also the cold differentiated tumor, and tumor arising from the lymphoid cell, tumor arising from the neural cell, and tumor arising from the meninges. There are the arachnoid space. So they are also called meningiomas, also having the different variants. So the major term, there is astrocytoma. The astrocytoma, they are also having there is several different categories of the tumors. They also can derived from the, they also can derived from the astrocytes, and they are also can be recognized, and they also can including number one, there the astrocytoma. They are also having the different variants called the February astrocytoma, and they are also having the glioblastoma multiform, and also the pilocytic astrocytoma, and also called the pleomorphic. The pleomorphic xanthocytoma. So these are the some variants, and they also can occur within the arising from the astrocytes. So these tumors, and they will also having their characteristic histological feature, different characteristic histological feature, and there are also having the distribution, and within the most part they also going to occur within the brain, within the brain, and age group, different age group, and also the some there the typically they also going to occur typically affected, and also the some there the another the clinical correlation, okay, clinical course of the disease. So different also having their characteristic feature, including the tumor. They are the distinction feature of the histological feature. We also differentiating from the different grades. So the astrocytoma, there is fibrillary astrocytoma. Fibrillary astrocytomas, and they will also can be shows. It is also a spectrum of the shows the spectrum of the some the histological differentiation, and that also can be correlated with the correlated, and within the most probably is the clinical consequence. Okay, consequence also can be consequence, and with the and also there also having the an outcome. Okay, so some of the morphological changes that also can occur astrocytoma. So among the diffuse fibrillary astrocytomas. So these tumor, and they will also can be well differentiated, and most probably, and also there also can be the well differentiated astrocytomas, and or from the less differentiated, they also can call the high grade, and from they also can be ranging from the and from the anaplastic. So high grade to the anaplastic astrocytoma. So these are the some variant, and from the that's why anaplastic to the glioblastoma multiforme. There are also in the 4 grades of astrocytoma, from well differentiated to less differentiated, and to anaplastic, and they also can go into the glioblastoma. This is very highly anaplastic tumor. So the in the glioblastoma multiforme, there's a glioblastoma. These tumor, they will also can be variable, and they are also having the variation, and in the growth. Most probably they also can vary in the growth appearances, and the gross appearances of the these tumors, and from the region to region. Okay, region to region, it is also a characteristic feature. So these some most probably some areas, and they are also firm, and also the whitish in color. Okay, in this condition, some area they also appear as firm, and also the white in color. White they also can appear, and others, and they are most probably the soft होते हैं, उसके बाद soft, and also the some there is the and yellow in appearances, and yellow. So these also some there are also there the some gross differentiation, and there they also going to be as a result from these tumor. So they also going to appear. Okay. These tumors, and they also can be appear, and they also can be well differentiated, and mostly these tumors they also going to appear the well demarcated, and from the well demarcated, and from the most probably there is the surrounding and brain is also brain tissue. It is also can be brain tissue, and but it also can show the infiltration, and beyond that also can be this the most common side, the cerebral hemisphere, is also can most commonly affected in this type. So it's also some the grading of the they also a grading of the astrocytomas. Astrocytoma from the well differentiated, and they are having the 4 WHO classification of astrocytoma. So from the well differentiated, and to the less differentiated, and to the go for the high grade, and then after the anaplastic, and from the the glioblastoma multiforme. So these are the 4 grades of the tumors of the astrocytomas. Number 1, grade 1. Grade 1, so well differentiated to anaplastic, also can be uh, categorized in the 4 grade. Grade 1, they also having some changes also can occur in the microscopical features. Number 1, first of all, grade 1, they also can show increased cellularity, and also they're also having the increased cellularity, no pleomorphic features, and also the no any metatic figures. In the grade 2, they also having the most probably they're showing the more cellularity, and also the few polymorphism, and also occasional mitotic activity that also can be showing. In the grade 3 out of 4, so they also can showing the more cellularity and polymorphism, and also they're also having the mitotic activity more also can be seen, and they also can showing the hemorrhage. So these are the some microscopical features they also can showing in the grade 3 astrocytoma. So the grade 4, and out 4 out of the 4, they also can showing there is more cellularity, and there is more polymorphism, and also the some there is more polymorphism, and there is more metatic activity, metatic figures, and hemorrhage, and along with the and large areas of the necrosis. So they are also having their 4 grades of astrocytomas. The most common site is also a cerebral hemisphere. So astrocytoma, they also can be divided into 4 grades: grade 1 and grade 2, grade 3, and out of grade 4. So they also have different some their histological features. Now some other the microscopical features, most probably they are showing the macroscopic features. They are well differentiated fibrillary astrocytomas. Fibrillary astrocytomas, and they are most probably some they are characterized, and by the they also can be characterized by some there the mild to moderate. They also can having the mild to moderate. There is increase. There are also having the increased cellularity, mild to moderate, increase the number of the glial cell. Okay, they are also having the number of the glial cell, increase number of the glial cell, and along with the no polymorphism, and so the no any mitotic activity. That's also showing in the well differentiated astrocytomas. Some there is anaplastic, most probably there is the anaplastic astrocytoma. They will also can be showing some there is high polymorphism, and also the increased cellularity, and showing here the large area of the and hemorrhage and necrosis, and along with the higher mitotic activity, and more polymorphism. So some there the other like the glioblastoma multiforme. So this is also a glioblastoma. So they also had previously known as the glioblastoma multiforme. This is a highly malignant tumor. They also can comprising more anaplastic features, comprising that the more increased cellularity, there's a more polymorphism, and there's a more mitotic activity, and along with the hemorrhage and necrosis showing in the microscopic features of the glioblastoma multiforme. So for the most probably the diffuse family pattern. So the WHO classification, WHO scheme, and they also can be separate these neoplasm or the tumors or central nervous system, and into the well differentiated, and they also can well differentiated astrocytoma. They also can get the 2 out of 4, and anaplastic astrocytoma, they are graded in the grade 3, grade out of 4, and also the glioblastoma multiforme, and they also can get the 4 out of the 4. So this is also a grade distribution from the well differentiated and to the anaplastic astrocytomas. So they are also having the different diffuse fibrillary pattern, a different type of the astrocytoma, comprising the diffuse fibrillary pattern, fibrillary astrocytoma, and also the pilocytic astrocytomas, and there is the some there is the polymorphism astrocytomas. Some of the clinical features. So the most probably they are presenting symptomatic symptoms. They are also having their symptoms of the astrocytomas. There also can be depending on the involvement, depending, and they also apart from the involvement of the lesion. So the most probably they also having their this tumor they also can showing their headache and seizures and also the some other their neurological deficits. So these are the some most probably symptoms that also can occur in the intracranial tumor comprising in the astrocytomas. Patients and most probably and usually they will also having their usually having the more rapid, most probably they also have a rapid, there is a clinically rapid clinical, most probably there is a deterioration, clinical deterioration, and they will also having their that is also developing generally, they are also generally, and they are also having their correlated uh, correlated and with the most probably there is a appearance of the anaplastic features. Okay, so these are some features that also can comparing and within the in the different type of the cytomas. So this is also called the diffuse fibrillary pattern. So they also can be from well differentiated cytomas comprising also having there is a glial cell, and they also having there is the less mitotic activity. There's also having there is the mitotic activity. They also sharing there is the mild to moderate pleomorphic lesions. So this is also called as the diffuse fibrillary astrocytomas. So they are also called as the glioblastoma multiforme. So this is also highly invasive tumor, highly anaplastic tumor. They also comprising there is the glial cell and also with the high pleomorphic activity and high mitotic activity, and also the some areas of the necrosis. So this is also gametocytic astrocytomas. So other than some there is the so this is also pilocytic astrocytomas. There are so different categories. They also can be occur pilocytes, and they also can be the pilocytic astrocytomas, and they will also can be designated. They also can be most probably they distinguish and from the other types, distinguish from the other types, and by their also having their some the pathological appearances. Take pathological appearances, and also the some there relative. They relatively some they are the some the benign behavior. So they are so typically these tumor they also can be typically they also can occur and within the they also can occur within they also can occur in the children's and also the young adults. The most common population they also can occur in the young adult group. Young adults, and they are usually they also can occur usually located and within the usually located within the cerebellum and may also may also can be may also can appear within the they also can appear and appear within the floor, and also they also can occur within the cerebral hemisphere. So these are the some feature. There are some there are the region that also involvement of the this tumor of the they also can occur from the third ventricle. Third ventricle they also can occur, and now so this is also called a pilocytic. So they are also having there the hair-like structure. So hair-like projections they also can occur in the microscopical photograph of the pilocytic astrocytomas. This is also a variant of the astrocytomas, and the one that is pleomorphic xanthocytomas. So this is also a variant of the astrocytomas. So this is also known as the pleomorphic xanthocytomas. So these are the आपसे कोई पूछे some they ask the question, some they what are the different variants of esophageoma. They are also categorized. Number one, there is the fibula esophageoma, and also the pellucid esophageoma, and xantho, and the pilomorphic xanthoesophageomas. So these are the some types or variants of the esophageomas. So the brain stem, most probably the brain stem gliomas. So they also can occurs and it occur, and most probably in mostly they also can occur within the first 2 decades of the life. Most probably there's a decade of the life, and by the so these are the tumor. They also termed as some the esophageoma. We also been discussing discuss there the different type of the esophageoma, the classification of the esophageoma, and the different grading from the well differentiated to anaplastic, or well differentiated to less differentiated to the and high grade, and then anaplastic called the glioblastoma multiforme. There are 4 grades of the esophageoma, and they are also having the different microscopical feature, and different they are also having the most common distribution of the tumor, different regions of the brain. And along with the this is also a huge classification of the there is the tumor arising from the glial cell, and there are also having there the tumor, most probably there are 4 grades. Gliomas, some neural tumor, and the polyfinaciated tumor, and also the meningiomas. Other? Right? That's you. Yeah. All you do gliomas. Say. Hello, assalamu alaikum. So now we can also discussing some other discussion of the tumor arising from the oligodendrocyte. They are the glial cell. So these tumors, and they are there are so most probably they're the oligodendroglioma. Oligodendrogliomas, and they will also can be constitute about 5 to 15% of the 50% of the gliomas. The glioma 65% may say to 5 to 15%, and they are oligodendroglioma. They most probably occur within the 50% of the cases out of 65%. So these tumor, and they are most commonly, they also can be occurring most commonly occurring in the in the middle, most probably in the middle life, about the 4th to 5th decade of the life. The 4th to 5th decade of the life, these two most commonly occur, and these lesions, and they also can be found, and mostly they also can be found, and mostly and within the cerebellum. They are also having their most they also most occur in the cerebral hemisphere. Cerebral hemisphere, and with predilection and for the predilection and from the white matter. Okay, from the white matter in general, and most probably patients and with oligodendrogliomas, oligodendromas, and they will also having they will also having a good prognosis. Okay, so these tumor, and they will also having a good or better prognosis, and then most probably then the patients and with the astrocytoma. Astrocytoma say ज़्यादा जो good prognosis they also can most common occur in the oligodendroglioma. Okay, they compare about 50% of cases. The most commonly same hemisphere also can occur. The age group is about the in the 4th and 5th decade of life. Now, so these are some growth features. Oligodendrogliomas. Oligodendroglioma, they are the well differentiated, and they appear as a gelatinous, and some there are the gray, most probably gray masses. Gray masses they are often and the cyst formation, and they with along with the focal hemorrhage, and also along with the they are also in the calcification. They also can put some the area of calcification. On some the microscopical feature, they are the these tumors they will also can be composed of this tumor. They are also composed of the sheets of the regular cells, and with regular cells, and with they are also in the spherical nuclear, and they will also can be containing the finely granular, most probably finely granular chromatin. Chromatin they are also similar, most probably similar to the normal the oligodendrocytes like the chicken or microscopic test way. They are also composed of the beneficial cells. These tumors are well differentiated, and also the some other the WHO classification and oligodendrogliomas, and they are also can be considered. There is also considered and from considered to be from the well differentiated, and the anaplastic. And anaplastic oligodendrogliomas, there are also WHO grading about the 2/4, and they are the and most probably these tumor, and they also can be characterized by the some there the increased cell their increased cell number, increased cell density, most probably number of cells also can increase, and with the nuclear also having the nuclear anaplasia. Anaplasia like the polymorphism and the high matrix activity, and also the increased cellularity. There can be high number of the cell in the anaplastic cells. So some of the clinical features and these in the oligodendrogliomas. So this is also called the oligodendroglioma. They also having the well differentiated cell, most probably, and also the regular nuclear. Okay, oligodendrocytes. So they also having there is some so this is also called ependymomas. Ependymal cell and ependymomas, and they are the ependymoma. Most often they also can be arising, and from the next to the they also can next to the ependyma. Most probably they also next to the ependyma lined by the uh, ventricular system. You lining with the ventricular system. These tumors they also can be arising from the ventricular system, and they also can be including there also can be appear as soft and obliterated. They also contain the central canal and of the spinal cord. Most probably also going to occur in the central canal of the spinal cord. So these tumors, and they will also having their so these tumor they will also having their in the fourth ventricle, ependymomas, and they are typically they are appear the solid or they are also having the peppery moss, solid or peppery mosses. They also can be seen, and they extending and from the they also can extending and from the floor of the and floor they also can extending from the floor of the ventricles. These tumor ependymomas and they are composed of they are also can be composed of the cells and with the regular most probably they are also there is a regular and there is a to round oval cells. They are also regular to oval round oval nuclear and with abundant. They are also having there with abundant. They are also having there the granule chromatin. So these tumors are also having the granule chromatin. These tumors they also can form the gland-like structures. Gland-like around most probably they also can be form the which is also called ependymomas. They are also having the groups of the cell, ependymal cells. They also can be comprising, and they are termed as the ependymoma, and along with the related and the paraventricular ependymomas. So this is also a subependymomas. This is a variant of the ependymomas. Some of the coral plexus tumor. Coral plexus tumor. These tumor they will also can be occur. Most probably they also can occur anywhere and along the most probably anywhere along the along the coral plexus. They also can occur along the coral plexus and they are most commonly and they also can occur within the children's within the children and in which in the children's and whom and they will also whom and they are most probably and they are most often they also can be found and within the lateral ventricles occur in the lateral ventricle. The most common site is the lateral ventricle in the children and adults, and they will also can be most often they are also can be found in the most probably found in the fourth ventricle. So they also called the coral plexus tumor. So this is also a coral cyst. Some of the neural tumor. There are also the neural tumor, ganglion cell tumor. So gangliomas is also some of the atypical cell, ganglion cell, nerve cell. So this is a medulloblastoma. Medulloblastoma is also a common tumor. So this tumor, which is also most commonly occurring predominantly, and they also can occur in the children. The age is about 5 to 3 years of age, and they exclusively they also can within the cerebellum. They also can occur. The most common is also cerebellum. So the neuronal and they also having the neuronal and some there the glial neoplasm, glial markers, and they will also can be expressed. So sometimes morphological feature of the medulloblastoma in the children, and they will also have their medulloblastoma, and they are located and within the they are also located and within the with the midline of the they are also located with the midline of the cerebellum, and but there are also there is a lateral location. Most probably there is a lateral location, and they are lateral locations, and they are more often. They are also more often. They also can be found, and within the they are also have within the adults. Lateral location is adult most commonly बच्चों में the middle line. They are also can be occur in the middle line of the cerebellum. Okay. The most common site, the age group of the glioblastoma is a very highly aggressive invasive tumor that also can occur in the children. Gross appearance of the medulloblastomas. So these tumors, and they are often, and they are well circumscribed lesion. They are well circumscribed and they are grow rapidly. They are also having they grow, and most probably there are also fibril masses, gray and fibril muscle, and they are grow rapidly and maybe the areas of the most probably some there is extensive most probably, and they're also having their way. Therefore, can be extending to the this tumor. They also can extending and to the surface of the cerebral uh, cerebral folia, and also the most probably they also can occur, and within the they also can be involving, and within the involving the leptomeninges. They also can occur in the leptomeninges. Microscopical feature. These medulloblastomas are highly aggressive tumor, and they will also can be usually usually there are so exclusively there are, and there are also the cells and highly cellular, and with the they are also having their way composed of the sheets of the they also can compose of sheets of the anaplastic cell, sheets of anaplastic cells. So they are showing that the high mitotic activity and high polymorphism, and then the area the hemorrhage. So these tumor they also can be shown medulloblastomas, because highly aggressive tumor, and they are the highly anaplastic cells. So this is also called the dysplastic medulloblastomas. These highly aggressive with the polymorphic nuclei. That's why the brain CNS lymphoma, this is also tumor, they also can occur within the so primary central nervous system lymphomas, cellular lymphomas, and they will also can be account for about the 2% of the cases. Okay, the 2% of the extranodal involvement, extranodal lymphoid tissue lymphomas, and they will also can occur in the 1% of the most probably they also can 1% as intracranial tumors. So this is also called the primary central nervous system lymphomas. Okay, so CNS lymphomas having the lymphoid atypical lymphoid cells. These are the meningiomas. Meningiomas, these
Hello? Hello? Hello?
Hello.
क्यों कोला ले जाएंगे
Third year तो
ना वोट के लिए बोले
and for the what है
वोट के लिए
what is that for
स्टडी ग्रुप आईडिया लाने से
जी local area in
मेडिसिन भाई को बोलो ओके बस को ये बंद करो से मेडिसिन वाला बंद करो